So sideline technique, I will just do a quick reminder about the position, client position. So first of all, knee bend, 2 towels, the towel underneath, tucked under, and towel above, stay above. The position of the head, very, very important that the towel is perpendicular to their head, not to the table. Do you see that the pillow is tilted? So it's more comfortable for them because you can see that it goes all the way into their neck. Yeah. Bring this shoulder out. Thank you. And then if you can tuck this underneath. Yeah. Let them tuck this underneath, and then prepare that. So once they're ready, all you can do is take that, and if the camera can come around, yeah, you can see kind of how it prepares. Yeah, it prepares nicely into here. Good. Sometimes you see that the lower shoulder is quite low, it's quite forward. Sometimes what you need to do is to take the arm and bring it a little bit more. Do you see the difference? Mm-hmm. That one would be a little bit harder to work on. Mm-hmm. Yeah? So you keep it kind of flatter. Yeah? The rest of the preparation would be a pillow in front to hug if you have. If not, then in this course we don't have so many pillows. So, okay. So with the hot stone, can I take this? Yeah, and open that. And then if you can take this hand backward in, yeah, and if you can take this strap in.
Might suppose a nice bit of space that's
yeah, fantastic. Good. So I will start actually with the top part, so neck and shoulder. And just as a reminder, you can work in 3 positions. First of all, you can come from the above position. You can come from the front position, so I'm in front of the client, and you can do certain technique in there. And then you can come from the back and massage in here. So the same with the hot stones. Why don't we start with simple hot stones technique? You would need either the small effleurage or the neck massage, neck stones. Yeah, and to start with, you would need to do the rolling, yeah, the flipping, and that can prove to be taking some time. So if you look now at the stones, just touch this stone. Yeah, it's quite hot, isn't it?
It is.
Yeah, it's quite hot. So you need to roll it faster. As long as you move it, that should be fine. So I use the trapezius muscle to roll over it. You can use the erector spinae here. Okay. Once the stone is a little bit colder, warmer, not very hot, you can slow down. And how do you know when you can slow down? You can ask them if it's still too warm, or your hand should be always a bit hotter than their body because of a direct, constant contact. So you feel that. So now I can start work. Now, the first thing I would like is to work on the pectoralis muscle. Okay. So you can do that by coming forward. Is it too much? It's okay.
No, just go.
You can do it this way. You can have their hand in a bit of stretch and massage. Okay. You can roll it here nicely. Be careful not to bump into the humerus too many times. Yeah, there is the biceps tendon here, and it sometimes can be easily aggravated. So try to avoid having the bone to stone contact. So that's the first place. Second one is the erector spiny. You go all the way to the neck, sorry, all the way to the scalp, to the suboccipital area. Even a bit of a traction there. Again, it is a bit of a bone to skull contact, but if you don't bash it over, that should be okay. You know? Right. Coming from above, you can actually, why don't we change? I'll start with in this position. So come backward. The technique I would use a lot is similar to that technique. Yeah? So what do I actually do here? I put weight onto the head, and then my hands are going to look for the neck erector spiny muscle. And then I put the head in a little bit of extension. You see the neck goes a little bit to extension, quite a little bit, but I just keep moving that way, you know, fairly little. So I massage and also do a bit of mobilization to the neck. Okay? You can do the opposite. You can traction and stretch this area. So the same thing you can do with a hot stone. Maybe not as precise, but any movement is better than no movement. Traction. Okay. Scalenes is my next place. However, when I would like to palpate the scalenes muscles. They are on the lateral side of the neck. And to be honest, there is not a lot of connective tissue around there. So be careful when you massage there, because you can very easily kind of bruise or having too rough contact. How does it feel? So this is a quite delicate area. You don't want to be too forward, yeah? You want to be just on the lateral of the neck, and relatively works quite slow and sensibly. Good. This stone doesn't feel very warm. You can always put it on the clients, come back to have another stone. I would like you to start working relatively quick with the changes, yeah? Yeah. Try not to leave the client too long unattended. This stone is more rounded, so the flipping I can do by using that axis flipping, yeah? Or you can use that flipping as well, yeah? So in the neck is relatively a smaller place that you can massage there. Yeah, you can now go again and visit the pectoralis muscles and then change to the spinal muscles and then change again. Yeah, cool. Next one, you can do a little bit more mobilization with it. Yeah. So I'm now on the subscapular muscle. Yeah, you can be on the teres muscles and do that. Yeah. on the erector spinae muscle. It's almost like you want to introduce their body into something inspiring new. You talk to the brain and you integrate it with movement and warmth. So something good is going to happen. Okay, then you can do the mobilization coming from here. So work with the laxity, yeah? Just that, very simple. Nice, you're working with the tilting, you're tilting it in. Good. Moving on to the spine. You might need a little bit more oil. I like to use the elbow to my body. It's easy. However, be careful because you see my wrist here. For some of you, it might be not great. It might be a bit too much, yeah? So then, I'll show you an alternative. First, let's change to a larger effleurage. Oops, sorry. You get a bit of splashes. Okay, so.
Looks nice.
So nice rolling. You need to start working quick when it comes to warmer stone. And it's a bit counterintuitive. If it's warm, adhere it to the client's body more. Don't make it superficial. Really deep in, so the heat can go deeper into their body, quicker. Yeah, a bit of the shoulder here. Yeah. So what's the alternative? The alternative would be to come from here and then work on the erector spinae this way. On the lower back is quite easier. However, when it comes to the shoulder, you need one hand over here as well. And you can use it a bit for mobilization or that, because you see what happened? They just move. It's okay. It's not the end of the world if it does happen. How does it feel this way?
I just smashed my face in the pillow.
Okay. So you might want to keep it stable. Yeah? Or come from above here and do it from here. Yeah? Because the problem is the shoulder area. You see, you have quite a lot of mobility, which is great, but when you want to work deep into the back, you need to stabilize it a little bit. Yeah? Work into the scapula. Yeah? Into here. Coming here. It's nice to work on the lower back, quite easy, especially the space between the hip joint, the hip bone, and the lower ribs. Kind of almost getting into the QL muscle, yeah? And then coming to the erector spinae from above and just pressing down on the side of it. Okay. From here, you can work a little bit on the upper glute as well, coming and sitting and very relaxing working on that. We can do after that lower body sideline. I think that would be enough, yeah? So really, the way I would like you to think about before the technique is your positioning. And what can you do with each position? You can do that movement here. I mean, we haven't talked yet about that movement. It would be fantastic to do that. Remember we did in the course? Yeah? So you can use it the same for hot stone, you know? Just adding more in this position, just adding a stone in your hand. Yeah? And then coming from there. Question?
When you've got client, my problem with sidelining is the moving from position to position, because obviously you've only got one side up. I don't know, it just doesn't feel very comfortable.
For them or for you?
It just feels like it cuts the
continuity,
flow,
yes.
continuity
Yeah.
of the massage.
Yeah.
I don't know if you've got any kind of...
I think that a lot of it has to do with our perception.
Okay.
And I would suggest you to ask the client, would they mind moving to the sideline? If they feel the benefit, they would say, no, it was good. If they wouldn't feel the benefit, they would say, yes, you moved me around for no reason. So it's actually the question of a benefit. If they would feel that you just move them and you faff around, they say, what is he doing? If they feel benefit and improvement and, wow, I didn't know that you can do it in massage, then they would say, yeah. But it's our own perception. A lot of the time, I felt the same thing because I start moving the client and I kind of break the atmosphere.
The bubble or whatever.
Yeah, I break the atmosphere. Try to do that with no, as simple. Yeah, a lot of it is our perception, I think.
Okay.
Yeah, so give it a try. It's worth a try, really.
Yeah.
Yeah.
Can we use hot stone for pregnant women?
What if we talk about contraindication?
And use this position to work.
Let's
on
talk
this.
about contraindication in a
Okay.
second, okay?
Yeah.